the most beautiful commentary on what we were able to accomplish. I've been working with her largely through telemedicine, but I got to meet her live for a visit last year. And when I met her, she's like, I just feel so much better now, and my moods are more controlled. And I feel like, oh, wow, like I actually am, I can control my moods. Last year, she said, I felt like things happened and I was not able to control my response. And now I realize with my hormones better, I can control them.
Hi there, and welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts who can provide insights to support you in your life-affirming practice and career. I'm your host for today, Miriam Diallo, APLOG's Communications Manager, and today I'm excited to bring on yet another expert in the emerging field of restorative reproductive medicine. Earlier this season, we had on Dr. Marguerite Duane, who spoke on her root cause approach to identifying and treating the modifiable risk factors for miscarriage. We also had on Dr. Richard Fearing, who spoke on the concept of the menstrual cycle as a vital sign. And today, I'll be speaking to Dr. Karen Poehailos, who is a board-certified family physician who is with FEMM, the Fertility Education and Medical Management Foundation. Dr. Poehailos will be speaking on how fertility education can be used as a tool for young women to bolster their understanding of their own bodies and help to identify and treat potential health problems early in their lives. So Dr. Poehailos, as I mentioned, is a board-certified family physician. She is also a founding board member of the American College of Family Medicine, as well as a USCCB Natural Family Planning National Advisory Board member, and a assistant medical director of the National Institutes of Family and Life Advocates, and a medical advisory board member of the Abortion Pill Rescue Network. I'm excited to be showing you this conversation with Dr. Poehailos. Let's jump right into it. Dr. Poehailos, thank you so much for joining us today.
Thank you. I'm so delighted to be here. Thank you for asking me.
Of course, of course. And to just jump right in, I started off by giving our listeners a quick overview of what you do, but I'd love to hear it from your perspective as well. Tell us a little bit about yourself and how you got involved in FEMM.
So I'm a board certified family physician. I graduated from the University of Virginia Medical School in its residency, and I've been in regular family medicine practice and in urgent care settings for a number of years. Around 1996, 97, I started exploring the world of natural family planning, restorative reproductive medicine more, because I felt called to align my practice with the teachings of my faith. But then I realized medically I had a lot to learn to be able to know, like, if you weren't going to be prescribing the pill to people, what were you going to be offering if they came to you with irregular cycles and things like that? So over the years, I've taken trainings, I've gone down the rabbit hole, as it were, and I've taken trainings in various models and have worked with them in my medical practice for the past, I'd say more intensely for the past 10 to 15 years. And I did the FEMM training in 2021. I was excited. This sounds very strange. I was excited during the pandemic because, oh, it's online and I can take it and not have to travel to do the class. So I took the course because I had been wondering for a while what it was about and what the medical protocols were about and how did it compare to what I was doing at that point. And when I took the course, I was stunned by some of the things I had learned because I thought I knew a lot about this before I took the class until I took the class and realized there's so much more to learn. And I started working with the protocols with my patients and was finding that to be successful in helping them achieve goals. And then I was asked to help with their with our monthly discussion groups, like facilitating us discussing certain cases. And then it turned into being contacted in December of 23 by the CEO, Anna Halpine, asking if I was interested in moving to full-time telemedicine practice with them, which I totally did not see coming. But after talking with family and friends and discerning it and praying about it a good deal, I was like, okay, this sounds like something that would be valuable helping others at this point. And I thought at this point in my career, it sounded like it would be an interesting change to go to full-time telemedicine from what had been full-time family medicine practice and full spectrum, taking care of from infants to geriatrics.
Absolutely, that makes sense. And you mentioned there's a lot to learn in this field, and that seems evident to me as we've interviewed a couple of different experts
Mhm.
in restorative reproductive medicine just in the past few weeks. And one thing, we've noted is that there's several different models of fertility tracking methods, et cetera. And so one thing I'm wondering is what are FEMM's distinctives on that front? What makes it unique as a fertility education and medical management model?
So, looking at, there are a number of models available, and in my role with the U.S. Council of Catholic Bishops on their NFP advisory board, I'm grateful we have so many models because rarely is it a one size fits all. So, I think it's great that we have a number of them, and I have been either teaching or being medical consultant in several of these over the years myself. When I look at them and what the strengths are, I think that are particular to FEMM, there's several things that jump to my mind. One is that our app, it's a free download on both platforms, the major platforms for smartphones. And it's like I can talk to a patient in an office visit about the app and have her even down in my prior practice. I used to have them just download the app in front of me and kind of give them a quick, here's how you would enter your data, and then say, we want you to like learn from an instructor and get instructed in it. But they were able to kind of look at the app and start playing with it themselves. It's a very user-friendly app. Women can enter whatever data they're tracking. So if they are tracking temperatures, they can elect to track temperatures through the app, and that will come up in the reports. Or if they are doing LH testing, that will come up. If they want to track symptoms when they're having mood swings or acne flares, whatever, they can track all that in there. So it's fairly customizable, which I like. And I think patients who are using certain I've had patients where like I like FEMM, but I'm still doing my temps, and I'm like, you can totally do your temps in the FEMM app. And also, we don't have ads and we don't sell our data anywhere. And I know that's been a concern for women, that, who's getting a hold of this or who else could be seeing it. And I don't want to see a bunch of ads, and I don't want my teenage daughter who's tracking to see a bunch of ads that I can't control. You're safe with this. So we do feel it's a well-developed app that meets the needs of women and teen girls using it, and is very easy to use that way. The other strength of FEMM that I particularly like as a physician are our medical protocols. The FEMM medical end is through the Reproductive Health Research Institute, and our medical director is Dr. Pilar Vigil from Santiago, Chile. And when we're looking at our protocols, we can actually start working with women while they, even if they are on hormonal contraception. Women may have a hormonal IUD, or they may be on the birth control pill written by their OBGYN or someone who's not me. But if they're looking at wanting to start learning more about their hormonal health, we actually can start the workup while they are still using these. And I think it has two good points to it. One is that I'm not telling the woman you have to stop this and track your cycle for a couple months and then I'll start working with you. They often want to have the process start sooner rather than later. And the other strength of it is that when I start working with women like this and I can show them that, okay, you were on the birth control pill for your polycystic ovarian syndrome, but look, your androgens are still high despite this, and that's what it was supposed to be helping you with. And let's look at why else your androgens might be high, your the testosterone, DHEA sulfate, things like that. That women start gaining confidence as they see me start working with them. And then they get the confidence. I've had patients say, okay, I really don't want to be using this IUD or the pill anymore. And then they're able to stop it and feel that they weren't forced to stop it, but that it became a natural organic decision for them after we started working with them and helping them with their imbalances. So those, the app and the ability of the protocols to meet women where they are have been strengths for me when I'm using it in my practice.
That makes sense, and it's nice that it's such a customizable kind of service. Just for some additional context, now when women download the app, are they automatically connected to a physician like you? Do they have to, is that like an upgrade where they have to pay extra, or how does that work?
Yeah, no. So women start using the app and they are not connected to anybody at that point. Um, that's why we encourage with the FEMM app, and I encourage women who are using any method of fertility awareness based methods to be working under an instructor so that they learn how to use it well, particularly if they are using it for family planning purposes. Please make sure you understand what you're doing and what you're tracking. Um, but when they're working with, if they're working with a FEMM instructor, there are certain patterns of abnormal charting or abnormal biomarkers that when these women are working with a FEMM teacher, the FEMM teacher will say, well, we really, I really think you need to be referred to medical management, and they'll help contact, they'll tell the patient, oh, here's who you could contact who has a license in your state, and then they can reach us through the telehealth platform. And then when they are seeing us, they actually can upload their FEMM charts into the secure patient portal. And she and I will look at the charts together during the visit on a screen share, and I'll point out what my concerns are with the chart.
And that,
So it's a beautiful interface, but no, they don't automatically get fed to medical management. It's on, like, either they know themselves that something's not right here when they're tracking themselves. And the app actually, if there's a certain number of abnormal cycles or certain abnormalities, it'll even tell the patient, hang on, this isn't normal. We would recommend you seek medical management.
mm.
So the app will tell them, but also their instructors can tell them. And then when they get to us, we share the date, they share their information with us.
Wow. Yeah, so definitely seems fairly robust and holistic in the sense
Mhm,
of you can serve patients with different needs,
mhm,
and yeah, that's pretty cool. Pivoting to, because we were going to talk about, of course how FEMM can be used to help young women, uh, youth fertility education. In your
mhm,
view, what currently are women being taught, whether in schools or by their physicians,
mhm,
about their own fertility around the time of puberty? And do you feel
mhm.
like, that information that they're being given is enough to help them navigate this transformative time in their life?
That's a great question. So, what I hear my patients telling me, and I see a number of teens through the platform for medical management when certain issues are identified, is that largely they are being told that, or if they go to their physicians, often they're being told, like, okay, your cycle started, painful periods are a part of life, and abnormal bleeding is a part of life, and acne is a part of life. And if you're having issues, the birth control pill will fix a lot of these. In their schools, I think largely they are taught that their fertility and their cycle health is more something to be feared or overridden. Like the fertility issue, like, okay, you could possibly get pregnant if you have sexual relations. So, oh my gosh, before you even think about dating anybody, you should be doing something. And there's a big emphasis on the long acting reversible contraceptives such as the IUD, which was interesting. When I was in med school and residency, we were taught not to even think about putting those in women who hadn't completed their childbearing, and now they're being recommended for teens. So
Wow.
that is something that has definitely shifted over the course of my time in practice. So women are being encouraged to get onto contraception very early in their reproductive lives to avoid the possibility of a pregnancy if they enter relations, instead of looking at fertility as a part of our health, as like when you go to a doctor's office and they take your blood pressure and your pulse and they get your height and weight and do your vital signs. Her cycles are a part of her vital signs. Like what her cycles are doing is not just the, oh my goodness, you could get pregnant now or not, but it's reflecting her overall health. And that is not something that should be addressed by overriding it. You need to be getting to the root causes. And I've seen teens where they've had, like, I remember a one woman I've worked with recently, times of very prolonged bleeding. She would bleed more days than she wouldn't bleed. And her doctor's only answer was, well, we need to put you on the birth control pill. And when I started working with her, we found out that she had several issues. And by just addressing those issues, we got her cycles to normalize. And she and
Wow.
her mom were really grateful because they had no idea she had insulin resistance or thyroid issues, but we found them. So I think there needs to be a change in what young women are being taught in schools and being told by their physicians, and maybe it being taught in their homes, because we need to educate the parents as well, as to cycles and fertility being a part of the normal part of being a young woman, and how do we work with that and not suppress it.
Right. Absolutely. So it seems like currently hormonal birth control is being leaned on very heavily, both from from the perspective of anticipated like behavior on the woman's end that she'll be sexually active soon, and from the perspective of uh, the idea is fixing her hormones or whatever. That's how it's being marketed. If she's having any hormonally related issues, but your perspective or what the insight that the restorative reproductive medicine field is introducing into what's currently going on is that that might not necessarily be enough to
Mhm.
fix, to take a root cause approach to what's going on in these young girls'
Mhm.
lives.
Yeah, it's not the best for the root cause approach at all. And also the idea that our cycles and our fertility are something to be feared rather
Right.
than something to be understood and worked with.
Absolutely. And on that point, Dr. Richard Fearing was just on a couple of weeks ago. I think we published
I saw that one.
his episode. Yes, yes, to talk about the menstrual cycle as a vital sign. So you guys
Mhm.
can, any listeners can go back and listen to that one for more information on that concept. Um, yeah, Dr. Poehailos, I'm wondering what does FEMM services introduce? You talked about, a patient that you had and just the root cause approach and how that's important.
Mhm.
Um, but what other thoughts do you have about what FEMM introduces to youth fertility education that's not currently being offered?
That's so we have actually two offerings. We have Teen Femme and Femme Men, and they're available on our website, and that information I'll give to you so that you can link it. But we have we have classes that young women can take and young men can take. Um, so both groups learn about the anatomy and physiology of their gender, and of so the women learn about theirs, but also learn a bit about men, and the men learn theirs and learn about women. Also, other practices like looking at how the brain controls the hormones, and what those hormones mean for physical and emotional changes going through puberty, and the physical changes of the body and the emotional changes. And we all know, like women know that that happens, but if it's not understood, it gets scary, but it needs to be understood so it's not feared and realized this is a part of life. Also, healthy habits, looking at healthy diet, adequate rest, looking at the media and body image, and what we are learning about body image in the media, and how does that impact young women and young men about their health? Are they looking at using hormones to try to, if it's a young man, is he wanting, is he getting tempted by somebody to use testosterone to bulk up, to have a different body image? And are women sometimes tempted toward eating disorders because of what they see on social media for what the ideal woman should look like? So that is addressed in the classes as well. And also the impact of stress. I think everyone can agree when we look at the current generations that they are under stresses that are different than their parents, than their grandparents, even than their older siblings, depending on age gaps. And we work with that as part of the classes as well, as how to look at handling stress and resolving conflicts. For young women, the class does include an introduction to cycle charting. So a number of my young women have taken the Team Fem classes. I have friends. There was a friend of mine who was at the recent meeting when you and I connected, and she mentioned that her third teen daughter was ready to start taking the Team Fem class. And she's like, would not miss it with them. She goes, this is so important for my daughters to have this knowledge. So we have information on those classes available through our website, and there are teachers who can be trained to teach them. They can be offered in individual settings, they can be offered in group settings, they could even be offered in school settings. So there's lots of options there, or through church settings, whatever works.
Right, right. And you mentioned cycle charting. It seems like you're saying that cycle charting is not just for married women who are trying to get pregnant. So tell us more about that. What are some benefits of getting started earlier?
Oh, so many. I have four sons, but if I had any daughters, they would have learned to chart years ago. Because it is such a way to learn about what a normal pattern is and when we're deviating from that. So I see young women sometimes where they may have a withdrawal bleed that they feel is a period every month and everything's fine, but when you look, maybe they don't see any cervical fluid. So are they ovulating? They may not be. Are they ovulating well? Are there flags about the length of the luteal phase between ovulation and the end of the period? Is there irregular spotting? When they start charting more regularly and noticing their cervical fluid more, they may notice, oh, wow, like that's a little bit pinkish. I'm having some spotting here. I never used to notice that I had spotting in the middle of my cycle. Well, that's not normal as well. And when women start learning how to track these patterns, and if they learn it when they're young, it becomes a part of them. And then when they do get older and they're married and moving into the family planning portion of life with this, charting isn't something that they're learning a month before the wedding in a panic. They've already been doing it and it's just a part of their life. And I've worked with that young one with the irregular bleeding was one case of it. I had another young woman that I started working that she had issues with some bleeding issues and a lot of emotional issues and anxiety. And her mother was like, something just isn't right here. And when this young woman started tracking and we did some blood work on her, she's a very thin, low BMI young woman who ended up having incredible insulin resistance when we did her blood work and
Mm.
had some issues with thyroid and prolactin. And when we addressed those, the cycles kind of normalized, but probably to me, the most beautiful commentary on what we were able to accomplish. I've been working with her largely through telemedicine, but I got to meet her live for a visit last year. And when I met her, she's like, I just feel so much better now, and my moods are more controlled. And I feel like, oh, wow, like I actually and, I can control my moods. Last year, she said, I felt like things happened and I was not able to control my response. And now I
Mm.
realize with my hormones better, I can control them. And she was so empowered. And I almost cried because I just felt like this adolescent feels like she's had such a sea change in her emotions going through all this. So it's about the cycles, but it's not even just about the cycles.
Right. That makes sense. It's about being prepared for the future, but also it seems like you can identify and treat
Mhm.
issues that a lot of people might dismiss as just a normal part of being a moody teen.
Right.
Yeah, there's getting answers there. It's really opening up some options for a lot of young women. Um, yeah, I guess just moving on to how medical professionals can get involved. To any of the medical professionals listening, what would you say to them about how they might get involved in FEMM if they're interested?
Um, that is a great question. And one I get asked frequently at conferences and physicians going, wow, this sounds interesting. How can I learn more? So we have a page on our website that is dedicated to medical education, and that'll be available to you when this airs. So we have an education course, if this airs in time, coming up in Columbus, Ohio, June 6th through 8th. 2025, depending on when people see this. And that course is going to have two components. People will be live in Columbus, which is awesome. You get to network in real time with your friends. But also, it's going to have a live virtual component. So we're going to be hybrid. And when we break into discussion groups live in Columbus, there will be an online discussion group that will meet live and interact in real time there as well. And that course runs for 3 days. It has CME attached, I believe 18 CME hours for the 3 days. And it is going through it's going through lectures about the underlying hormones. And then it goes into like our medical protocols. And I think one of the best parts is our case studies because we're looking at studies from actual patients and what they presented with and what their blood work showed and what their ultrasound showed. And we're like, well, what would you do next? And if you did this, what would happen here and what would happen there? And people are coming at it from various perspectives. There's family physicians there, there's obstetrician gynecologists, we've had endocrinologists, we have nurse practitioners, we have certified nurse midwives, we have physician assistants. working in various settings who are all learning this together, and each brings his or her own perspective from what they have seen in their own practices. So that course is available in June. There is an intro course you need to take prior to that. That is on demand, and that can be accomplished very easily before the course starts. If you are seeing this later than June and you're like, darn it, I missed it for the whole year, the good news is that course is actually available on demand. So obviously you don't have the live interactive component, but you will get to see what happened there. And again, you get the CMEs and you will get to learn how to do it. Once you go through the medical management, the intro course and the medical management course, you're added to a email listserv, and we regularly will go through the listserv about cases and like what would you do with this next. And one of the strongest points I feel for our continuing education for our medical team is the monthly case discussions. And I precept on some of those where people can bring their own cases and present it in a Zoom. We offer 3 different times once a month, all on the same day, but like to accommodate 3 different time zones, so that from anybody from, we have people who are using FEMM over in Tanzania and the Philippines, we can accommodate them all the way through to the West Coast of the US and make it work. So we bring the cases and discuss them. And then we also have advanced case discussions with Dr. V. Hill, where people who have been to the regular ones and presented a case are invited, and we look at more advanced case management with her, and that's always a tremendous learning experience.
Wow. Very cool. And as you
Keeps us
said,
very busy.
definitely seems very busy. And for that June 6th course, I'll try and get this episode up before that so people can know. Forgive me, is there a registration deadline? Or can it just...
That's a great question. I'm not aware, and I will find out and let you
Okay,
know so you can.
absolutely.
I think for the virtual one, I think, and if I'm remembering from last year, I think they could register pretty late up to before it, but they may not get the written materials in time for it because people who are doing it virtual and not coming out to Columbus, you get your books and stuff mailed to you. So you may be doing without having the books at home, but then we also put the cases up on, when we're doing things, we often do screen shares and stuff. So I still think it would be doable, but I don't know the exact deadlines,
Okay,
and I
okay,
apologize for
no
that.
worries. We'll find out when we'll put it in the show notes. So,
Thank you.
yeah, and one last question for the teen girls or parents of teen girls who might be listening to this episode right now. What can they do to learn more about FEMM and download the app and start cycle charting and everything with all you have
So
to offer?
our website is femmhealth.org, and if you go there, you can find across the tabs at the top, you can find the app and download it. If you have Android or Apple phones, you can find the app and download it and start playing around with it, as it were, learning the lay of the land, testing it out. If a mother or a teen is interested in learning how to do like the Teen Fem class and start tracking, there's information on classes there. There's also we have through our telehealth platform, one of our providers is a FEMM teacher, and you can schedule with her through the telehealth platform. But also there's information on all the other people who teach, and you can find a FEMM teacher and set classes up for yourself or for yourself and your daughter and work through this together. And that would also go if there's a young man, if there's a mom with a son going, I'd like my son to learn the boy part of this, then there's information on that page, on the teen page as well. And again, we'll have that link in the program notes.
Okay, very cool. Well, thank you so much, Dr. Poehailos, for all that information. And yeah, it sounds like something that both medical professionals and young men, young women can benefit from. So yeah, thank you for all of those insights here today.
Well, thank you for having me. It's exciting news to share, and I'm happy that we're able to get it out more.
Yeah, absolutely. And thank you so much to our audience as well. If you like this episode, of course, as usual, be sure to like it on YouTube and give us a 5-star review on whatever podcast app you're listening to. I look forward to seeing you next week for our next episode.